Today I'm talking about lip filler and the common questions I get asked in clinic from my patients. My name's Eve. I'm an aesthetic nurse practitioner prescriber based in the UK. One of the most common questions I get asked in clinic around lip fillers is regarding aftercare. All the aftercare advice regarding lip filler is aimed at reducing the risk of complication and to minimise swelling and bruising, reduce the risk of infection and promote good healing. So not only do you end up with a lovely result, it's also a safe result. In my opinion, the most important thing to remember after having your lip treatment is not to touch the area. We want to keep your lips as clean as possible and avoid introducing any bacteria that could ultimately lead to infection. This is also why I recommend not to apply any makeup for at least 24 hours. As well as not touching your lips, it's really important not to massage your lips. And I know how tempting it is, because when your lips are first done, they can feel a little bit internally lumpy bumpy. And that's just internal bruising and swelling. But it can be so tempting to think that it's lumps of product that you need to massage out. Please don't do that. Trust the process. After about 2 to 3 weeks, those lumps and bumps should have gone. And if they've not, you need to be getting back in touch with your practitioner. So don't massage your lips. It's also important to avoid excessive heat for 24 to 48 hours. So this includes saunas, steam rooms, sunbeds, high intensity workouts. All of these activities increase blood flow to the lip area, which will result in excessive swelling. After treatment, it's really important to stay hydrated and make sure you drink plenty of water. This is to help your body recover and ensure the filler integrates beautifully to the lip. An element of discomfort after treatment is relatively normal. So your lips might feel a little bit tender, a little bit swollen. You can take paracetamol if required. It's also important to avoid aspirin and ibuprofen after treatment, as it thins your blood and increases the risk of bruising. This is probably a really good time to mention if you are in some discomfort with your lips and it's not relieved by paracetamol, that's a bit of a red flag, and I would be recommending that you get in touch with your practitioner. After treatment, if the lip area is quite swollen, you can apply an ice pack. Generally, I recommend a couple of minutes every hour. Just ensure that your ice pack is clean and you're not putting it straight onto the lip area. Ensure that you wrap it in a clean tea towel, a clean face cloth, because you don't want to end up with a freezer burn. I also advise leaving 3 weeks after treatment before you have any dental work. Finally, if you do have any concerns about your lips after treatment in terms of swelling, pain, abnormal sensation, abnormal colour, it's really important that you get in touch with your practitioner. Most clinics will arrange a complimentary follow-up 2 to 3 weeks after treatment, should you require it. Thank you for listening. I hope you found that helpful. Don't forget to like, follow and subscribe.